Rock Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to the show Fight Against COVID 19. Thank you for liking our show. It has become very important and everybody loves it. With this show, we are able to connect many people who are either in front line or working behind the scene tirelessly, selflessly to fight this against COVID 19. There are many kind of people, either they're making masks, or they're helping the hungry, or they're actually fighting in front line, or helping small businesses. We have gone across states in the United States of America, some in Atlanta, some in Texas, and some in Boston. Today we are interviewing someone very special, a Boston hero, who is actually working and really talking in front lines and is a doctor who will tell a lot about how he treats these patients who have COVID 19. We are really humbled to have him on the show and honored for the things that he's doing, risking his life to save ours. Dr. Ankit Patel, welcome.
Thank you. Thank you so much.
So, Dr. Patel, before we start about what you're doing, tell me a little bit about your family and a little bit about your background.
So I think background, grew up in India, did my medical school in the Philippines, and then moved to the States. Did my residency in St. Louis, and then finally moved to Boston, started working here. And then found my life partner recently, just before the pandemic started, which was a good thing.
That's amazing.
I got a lot of support.
So, Ankit, tell me a little bit about what you do and which hospital do you work in, and a little bit about your background, in terms of medicine.
Yeah. So I work through Team Health for Melrose Wakefield Hospital, which is a clinical partner of Tufts Medical Center. And primarily, I work with the inpatient or the hospitalist setting, day and nights both.
So, because you work in inpatient setting, I'm pretty sure that you see patients who have COVID, COVID-19, or basically have COVID positive. Tell me a little bit about, in general, how do you see these patients, and what is going on in in your practice?
Sure. So for if I do the regular day shifts, then we usually have multiple COVID cohorts or isolation units where we have all the suspected or confirmed COVID patients, so that way there is less cross contamination. So you have all the protective equipment. Most of touchwood, we haven't had to go without any of the personal protective equipment, which should be necessary. So Team Health or Melrose Wakefield or the administration had done a great job. So we put the whole gear, go into the isolation, and then try to do all the patients in one setting to minimize the amount of time you go in and out of the COVID isolation units. And it helps with the easier management compared to the other people who does not have COVID.
So, what are some of the common symptoms you see in patients, and generally when they come in?
So usually, I think this initially it's always the suspected because we don't have the test results, or sometimes we do have the test results. But most commonly, I think fever, cough, shortness of breath are the primary. But then there is also nausea, vomiting, few of them diarrhea, and then some of them with just non-specific dizziness. And then, of course, I haven't come across somebody with the loss of taste or smell, but then that also is reported. And then there is a few people with a TIA or transient ischemic attack or mini stroke or things like that.
So when a COVID patient comes, like I think the point is that either you have some symptoms that you really know that maybe they have COVID, and sometimes there is symptomatic, but they have been in contact. How does that differ?
I think the biggest decision, what I would say, is between you have possible COVID or just an exposure. I think the degree of severity or the transmission would be most likely depending on if you are symptomatic or you do not have symptoms. Because if you do not have symptoms like fever or any active symptoms of cough, your likelihood of giving it to somebody else, it's always there, but it will be very less compared to somebody who is actively symptomatic. Then they can aerosolize the secretions or droplets and then go forward. So Just an exposure wise, I think they can just get a test even without coming to the hospital through the drive-through clinics or through the primary care physician. So,
So, in your opinion, of course, we understand this is not the Melrose Wakefield Hospital's opinion, but in your opinion, do you think the testing is increasing, or there is increased awareness of testing now that that can help people to get tested?
yes, I think definitely, especially with all the news media and all the publicity that goes around, and we have seen like thousands of tests increasing on a daily basis, day by day. So we definitely have a lot of test availability, and right now I think it's expanded to the whole population, at least for the state of Massachusetts. So not just for those who are sick.
So when the patient comes, what is your line of treatment? What do you start with? Like normally, I mean, these patients must be very nervous and scared. How do you actually start talking to them and just trying to understand the emotional aspect
Yeah.
and treatment?
I think that's the very challenging aspect, especially when the patient comes in the emergency room. They're already put in an isolation room, and all the rooms they have the plastic curtains, so there is hardly any interaction. They are by themselves wearing a mask, and whoever goes in has the full gear. So
Yeah.
I don't think the patients even know that is it a nurse, a physician, a secretary, or who is the one in and out of the room. And without putting a face to the name, I think the communication or the trust is extremely difficult to develop, at least personally.
Yeah.
And then even if we talk to them, we have to speak very loud, especially with the masks. And then if they're especially most of the people who come in sick are usually our senior citizens. So hearing is always a challenge anyways to start with. So I think the anxiety is on both sides, that we feel that are we able to communicate effectively, and then how do we make them understand that it's a new disease, but there should be some level of trust, which is I think the starting point. And then there is like multiple people in and out so quickly that by the time they come to their room, it's almost like at least 6 7 people on an average that must have been in and out. So I don't think they can remember the
Who actually came in first, right? So, in terms of treatment, do you start the symptomatic treatment? I know we hear a lot about. We talked to a physician a few days ago, and he talked about ventilators. Tell me more about the symptomatic treatment. What else do you guys give? Like I think fever, other things. What? How do you treat?
So of course, I think treat symptomatic meaning. So we treat the fever, give them IV fluids if they are dehydrated, if they have cough medicine. So if their oxygen numbers are low, give them supplemental oxygen. Now these are the most important aspects of this treatment, as currently the only available treatment is supportive care.
Sure.
And at least even for our hospital or as a team, initially hydroxychloroquine or the malarial medicine was very popular,
Yeah.
but we stopped it completely. As a matter of fact, that even there is a lot of studies internationally that
Yes.
showed too many deaths or side effects. So many people are dying from the drug rather than actual disease.
Yeah.
So we are not doing any hydroxychloroquine. And then there is talked about the Z-Pack or the azithromycin antibiotic. But if somebody does not have any signs of a bacterial pneumonia, we don't even do antibiotics.
I see.
The goal is to not do any harm by doing any extra medications. And so supportive care. But the one thing that we have seen, even keeping the ventilator or the sicker people aside, is proning or prone position, where we let them,
Interesting.
as long as they can cooperate, they're alert, they can lie on their belly even for a few hours. We have seen good improvement in their
Interesting.
oxygen.
So just lying behind on your stomach,
Lying
basically.
on the stomach, yeah.
Very interesting.
Yes.
And that helps them relieve the symptoms a little bit, I guess.
Yeah, so their oxygen requirements go down
I
in
see.
a matter of hours or by 24 hours, and many of them are able to breathe better. And that's the whole concept. So even on people who are not really sick but requiring oxygen, just trying to see if they can cooperate laying on the belly helps a lot.
Yeah. So, tell me a little bit, Ankit, about what are some of the challenges. Of course, the personal contact with the physician with the patient is a challenge, because in our profession we love to understand the patient and have that connection. What are some other challenges that you've in these situations?
I think the one biggest challenge is how do we get the trust of the family members?
Yeah.
Just the phone calls. So I think what our team is doing is we have the Doximity app, which has a HIPAA compliant video calls. So personally, what I and my other team members have been doing is we try to talk to the family first. If somebody has a smartphone, at least I try to get a quick video call, show them their family members, and at least they can hear a familiar voice. It's a little emotional connection.
Yes.
And if somebody is not doing well,
Yeah.
I still do the same thing. I go into the room, have the video call, and at least have the family a chance to say their last goodbyes and convey their emotions. And I think that's the only little bit of trust we get to develop with the family. So it's stressful even for the providers.
No, I think absolutely these are one of the big struggles for this disease, because I think it's a disease of isolation, and you're just left alone with nobody, and that's very tough for a patient and a physician as well. In terms of just how do you basically feel? I mean, this is a very tough job, going and risking your own life daily, knowing you don't know whether you may catch or not catch. Why are you doing this? Of course, as a doctor, I know that, but why are you doing it?
So I think the love for medicine is always there. And then I think what happens is as you do this work, there comes this little appreciations from the team, family, friends, or the staff members. And I do have an example that I would like to show. So I think we have a lot of people from Melrose community. This is what I found on my car.
Can you move it this side so we can see the whole thing on the right side a little bit? Yes, that's perfect. Oh my God! In case you need a rainbow, thank you. That is so wonderful, Ankit. And that
I don't even know who was the one who made this and left it on my car. So I think these are the things that will keep you going. And
that is very touching. So, for us, this show is basically to try to connect people, to create awareness. We could talk to many, either frontline people or behind the scene who are making things. I know you also are working closely, your better half is working closely to start an initiative. Tell me a little bit about that initiative.
So I think through her, I came in touch with two of the groups that I'm supporting or helping whatever I can. One of them is called Care for Janitors, where they try to cater food for all the healthcare heroes who are kind of on a different level of work. Equally important, or I would say even more challenging, especially. So they focus on getting all the free meals to janitors across various hospitals. And then the second group that I have been a part of, and even I have received donations with the masks and the head caps, is the group called Sue We Care. So that's another group that has been very kind and generous to the community.
So you are a doctor who's in the front line helping COVID patients, but then also supporting these really community-led efforts. I mean, you're really a big hero in my eye, and working so hard. Tell me, what are some of the things you want to say to people, who are listening to you? What message do you want to convey?
So I think one thing is it is normal to be anxious. It is a disease of unknown or uncertainty. The biggest thing, the very important thing here is things are already starting to get better, and not focusing on all the negatives. There's a lot of hope. Finally, we are seeing the decline. Many people are recovering. People are going back home. And then as long as we follow the guidelines, stay in touch with friends and family, follow the protocols, whatever the government or their local healthcare people are recommending, I think it's definitely going to be a victory for us. And taking care of mental health, apart from the physical health, especially having faith in whatever religion, superpower you believe, is extremely important, I think. And that's what will keep all of us go through this difficult phase and then make it as a history.
So, Ankit, one question I always had, somebody being frontline, I wanted to ask, what do you say to a patient when you first time see them? Like you see this patient, and how do you connect? I know that you can't see, but what do you say to them?
Yeah, I think the one thing that I have as a common thing is after I introduce myself, I explain my role, I introduce them, and at the end of the conversation, what I say is, I'll take good care of you, and which family member do I call right now, and make sure that they know you are here, and is there any specific message that you would want me to convey to your family? And immediately I think we can see a little relief that at least this unknown person will at least be in touch with my wife, kids, and whatever message they have. And I assure the family on the same side that I will keep in touch with the daily phone calls and even more than daily if needed. So I think that's at least a good starting point is have the family in between the conversation. So at least they know that they are not going to be left alone.
Yeah. So it's a very, from a physician to physician, are you scared anytime going in?
I think every time when I drive to work, I
Yeah.
have a little anxiety.
Sure.
Then I feel that I look up to the sky, I pray, and
Yeah.
then I go in. And after that, you don't feel it. But yeah, every morning I do have a little anxiety.
Of course. I mean, you're risking your life to be there, and you never know. So it's a big humble thing. You know, all when you actually kind of think about this in the long scheme of things, you say, what do you feel like in general about the whole situation today about COVID?
I think it came as a shock for all of us. And then I think the one thing that it makes us realize is it doesn't matter third world country, developed nations. We know how unprepared we all were as a, just as humanity. And I think it gives a time to reflect that maybe what all steps could be done that should this kind of thing happen again, how much do we all need to be prepared in terms of equipment, family support, work wise, financially, and saving the earth, of course. There has been a lot of talks about global warming and things like that, and now we see everything is so beautiful around
Yeah.
amidst the crisis. But I think there's a lot of things that I think we all can do.
Started accepting the values of life.
And then
right?
it all goes back to the basics wash your hands,
Mhm.
stay hygienic on a daily basis,
Right.
even without the pandemic. So
Yeah.
it gives simple things are still important.
Yeah, it just teaches you in life what is important, really. What do you think about these latest treatments like plasma donation and other treatment that we are talking about that Gilead is making and vaccine? Before we go, tell a little bit about that.
Sure. So I think I'm thankful that Melrose Wakefield is a clinical partner of Tufts.
Oh,
So
wonderful.
we do have a channel where if there is any young or very healthy person who is extremely sick or ends up on a ventilator, God forbid, we have a way where we can transfer them directly to Tufts Medical Center where they go through these clinical trials.
Mhm.
So we have sent quite a few patients there, and it's up to the Tufts Medical Center. They are investigating various drugs.
Mhm.
Also, plasma is something which is up and coming about, and
Mhm.
I think there is a lot of private labs or even major university centers who are doing it. Even internationally, there has been a few reports about many people getting off of the ventilator at least, whoever received the plasma. It's a way of passive vaccination
Mhm.
where you give the antibody
Antibodies,
and
right.
let it fight the virus directly. So I think those are going to be extremely helpful. And of course, the vaccine, I think it's in progress. And vaccine is the one that we need to keep it under control even going forward. So I think all of these things are going to be extremely important.
So one question before we go. This is always a question I have. I'm sure you guys. Will this ever end? How will this be? What will be the new normal?
Yeah, I think will this ever end? I think my gut feeling is I think it's going to come to an end like all bad things.
Mhm.
How long? It might be a few more weeks, a few months longer, but it is on the decline.
Mhm.
And I think the new normal, which is a very good term, I think it's not never going to be the normal like before, but the new normal will be at least many people might try to make it as a lifestyle change or a society
Like
habituary.
wearing mask or gloves anyway, irrespective. Yeah.
Important on a daily basis, keeping social distancing may not be 6 feet, but some kind,
Some kind.
avoiding overcrowding, and then I think going forward, that's going to be the new normal. And then I think the one thing it has made all of us realize is stay in touch with the family members
Yeah.
because there might not be another opportunity. I think so.
That's
It has brought all of us closer as a not just as family but as a planet Earth. I would say.
No, thank you. Those are really great words because it makes you realize what's important in life, your family, your values, the basic things that you talked about. So I want to really thank you from behalf of My Dream and me, humbly, for doing such great things, Dr. Ankit, for risking your life for hours and saving a life. You are really a hero. in front line. So thank you again for doing all what you do. And thank you for coming on our show and talking to the viewers.
Sure, no problem. Thank you. It's a pleasure. Thank
And
you.
take care. Thank you. Good night, Ankit.
All right.
Bye.
Thank